So my name's Dr. Tim Adamowitz. Congratulations on your Couch to 5K journey here. We thought we'd do something a little different, and I would do the talk while on the treadmill, because hopefully that's what you guys are doing at home. So good job. My role here at Fisher-Titus, I'm a medical oncologist, so I treat all kinds of cancer. And people don't realize it, but obesity plays a really big role in cancer. Actually, in 2018, the American Society of Clinical Oncology, their big push for the year, their big drive, was to educate everyone that the #1 risk factor for Americans in cancer is not smoking. In fact, it's obesity. So there's a lot of data to support that the healthier you are, the lower your risk of cancer, and a big part of overall health is your weight. So our segment that we wanted to do this week was to try to give you reasons why you should lose weight and be healthy and how it relates to your cancer risk. I'm going to go through some individual cancer types and give you very specific data that we have. And these aren't just generalizations. We've examined these cancers in large groups of people and broken them down by weight. And I'm going to go through and try to show you how much more common cancers are in overweight people and by how much. As an introduction to this, it matters what your BMI is specifically. And so if you don't know what your BMI is, it's your body mass index. You would be considered overweight by BMI at 5 feet tall if you're 128 pounds. At 5'6", you'd be considered overweight at 155 pounds. And at 6 feet, you'd be considered overweight at 184 pounds. You become obese at 5 feet tall at 153 pounds. You're obese at 5'6" at 186 pounds, and you're obese at 6 feet tall at 221 pounds. That puts me squarely in the overweight category. It actually does. I don't typically think of myself as overweight, but it is really hard to get to the normal weight goal in a BMI. So going forward, I'll talk about overweight and obese, and it refers to those weights specifically for heights. So for breast cancer specifically, you increase your risk of breast cancer by 12% by every 5 BMI that you're higher. So that would mean in overweight, you'd be 12% higher than the baseline risk, and if you're obese, it's 24% higher than the baseline risk. Also, losing weight helps. Women who lost more than 5 kilograms or more after the age of 18 reduce their breast cancer risk by 25%. For colon cancer is the 3rd most common cancer among men and women in the US, and it's the 2nd most common cause of cancer death in the US. 30 studies were performed and evaluated and suggested that for every 5 increase in your BMI, and again, that takes you from the overweight to the obese category, your increase in colon cancer risk in men is by 30% and in women is 12%. Ovarian cancer. Women who are overweight have higher risk for ovarian cancer. They evaluated over 10 prospective studies and 20 case control studies and found that overweight women had an increased risk of 10 to 20% for ovarian cancer. So for uterine cancer, endometrial cancer is the most common cancer in the US, with approximately 60,000 women diagnosed each year. With every 5 inches of waist size, you increase your risk of endometrial cancer by 30%. If your BMI is over 40, which puts you in the very obese category, your risk increases to 714% of what a normal weight female would have. Esophageal cancer and top of stomach cancer is also highly related to weight. That has to do partly with H. pylori, which is responsible for peptic ulcer disease. It's a bacteria. So that's part of why we always push people to get their upper endoscopies if they're having reflux, because if you get rid of the H. pylori, then you reduce your chance for esophageal cancer. But also, if you're H. pylori positive and you're overweight, then it makes you 4 times more likely to get esophageal cancer. The same rule applies for top of stomach cancer. For stomach cancer, if you're overweight, you have a 20% higher risk. And if you're obese, which is that really high BMI, you have an 80% higher risk of stomach cancer. Even kidney cancer is related to obesity. People who are overweight have a 1.3 times higher chance of kidney cancer, and if you're obese, you have a 1.8 times higher chance. Pancreas cancer is one of the worst cancers that you can have. Average survival with the new diagnosis of pancreas cancer is usually under a year. But you can reduce your risk of pancreatic cancer by 20% if you go to a normal weight and you're overweight, you reduce your risk by 20%, and by 50% if you're obese and you can get to a normal weight. Pancreatic cancer also is increasing in incidence. We're not really sure why, but it's going to be 50% higher by 2030.
Hi, I'm Jackee Porter. I'm the Oncology Nurse Supervisor here at Fisher-Titus, and I want to congratulate you guys as well for your achievements with the Couch to 5K, and hope that you continue this process after the race in November. So I want to talk to you a little bit about some risk factors associated with cancer and obesity. First topic is red meat and processed meats. So red meat is associated with an increased risk of colon and rectum cancer, and evidence also suggests it's associated with some other cancers such as prostate and pancreatic cancers. Some examples of red meat include beef, pork, and lamb. And the processed meats are your lunch meats, curing, salting, smoking, any chemical preservatives that are in those. You can also look at sausages and bacon. Yes, bacon is on the list, guys. Stay away. That is associated with an increased risk of your colorectal cancer, and evidence also suggests it's associated with stomach cancers. So alcohol and cancer. Alcohol increases your risk of cancer. Head and neck cancers is increased by 80%. Esophageal cancer by 30%. Liver cancer, 200% increase. For breast cancers, depending upon how much you drink, it can increase your risk by 5 to 60%. Colon cancer is an increased risk by 20%. In consideration of kidney cancer and Hodgkin's lymphoma, alcohol actually could decrease the risk of cancer. Really decreasing the amount of alcohol that you're drinking can impact your risk on cancer. And those of you that like to drink a little glass of red wine with your meal every night, bottom line is no drinking is the safest choice. Even though some studies suggest that a glass of wine may lower your risk of heart disease, researchers can't say for sure that a glass of red wine lowers your risk for cancer.
In summary, good job on your journey to fitness and health. Not only are you helping your risk for heart disease and a lot of other diseases, but your cancer risk is appreciably reduced as well. And I hope that what we presented to you here today helps you to understand that better. So keep up the good work, and thank you very much.
And we really hope that you continue all of your hard work and don't let it go to waste, and continue on through the new year. Good luck to everybody.
Yep, good job. Thanks.